most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Handheld, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to treat restless leg syndrome without drugs. These are 10 professional suggestions. We're not experts on restless leg syndrome or RLS, are we, Brad?
No, but we've
I
dealt
did the
with
research.
people.
Yeah, we had a lot of patients, and I've done the research. So we'll let you know what we have found out. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. That's a command. And go to the giveaway section. We're always giving something away. This week, we're giving away a handheld massager.
I forgot about that.
You want to be a liar, Brad?
Yeah, I'm sorry about that. But look at that. It's even got our name on it. We like it.
Yeah, it can actually get to those hard-to-reach areas. So go to Facebook if you want to find the contest pinned at the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
Perfect, Bob.
So, Brad, I gathered information from 3 sources that I thought were reliable. One was the Mayo Clinic. Oh, I used to work there, by the way. One was Cleveland Clinic, another prominent clinic.
But you didn't work there.
No, I didn't work there.
No.
And the last one was a study. And I'm going to read the study's title, which is always a boring thing that has multiple words.
Those PhDs really come
Non-Pharmalogical Interventions for Restless Leg Syndrome, a systemic review of randomized controlled trials. It was by Harrison et al. So
his name was et al.
No,
I know. Yeah, that's quite a title there. But it's
we'll put a link below so that you can hopefully look it up if you want to read it. But they mentioned a lot of treatments that had some success. To be honest, this is probably for people who have maybe a mild case of restless leg syndrome. If you have more of a intense version, you're probably going to have to get pharmacological help.
Yeah. So, but some people may not be completely aware of what restless leg symptoms are.
Sure. Yeah, we'll go over some of the signs. One is the urge to move your legs. And you're going to feel like uncomfortable and unpleasant sensations.
Is this throughout the day or just at night sleeping?
Mostly at night.
Okay.
And during an activity. It's the sensations are often what I hear is like it's creepy, crawly, weird thing that keeps people awake sometimes too.
It's annoying.
Yeah. So it does begin or worsen during rest or inactivity, and it's partially or totally relieved by movement. So like if you get up and move, it often
dissipates.
It dissipates, yeah. So, but as you can imagine, it can be very disruptive to sleep patterns.
Yes, yeah. I've had patients where they hardly are getting any sleep because of this, and that's the more severe cases. They need to get some medication so that they can get their life back in order.
So with all these, what you want to do is try it. Try it for a few weeks. See if you see a difference. And if you don't, then you might as well not do it. I mean, it doesn't work.
How many options do we have, Bob?
We have 10. So we'll start off with number 1, avoid caffeine. Try that for a couple of weeks.
Sure.
And see if that makes a difference.
Right.
2, you might try a magnesium supplement. It may help. You might have a deficit.
So go get some capsules type of thing from, it's a natural.
You want to check with your doctor to make sure it's okay, that it doesn't interfere with any of your medicines or anything.
Exactly.
The third one, this was in the study. I found it interesting. Infrared therapy or infrared heat tends to help.
So the far infrared?
Yeah. So we actually often talk about this Thermatex. It's far infrared heating pad.
Right.
And what we like about it is actually
it's in there.
The heat penetrates a lot deeper than normal regular heat. That's normal heat. You can see it just penetrates like a millimeter.
Right. So if you buy a hot pack, just a normal hot pack down at or online or whatever, it costs you $30, $40. It's only going to go skin deep.
Right. Far infrared heat goes 2.36 inches. So it really gets into the muscles and even into the bones sometimes if it's over your back.
Right, and it's not an
So
aggressive heat. It's a mild heat. It's not going to burn you. We really have had good experiences as well as our patients.
right,
And if you're talking about restless leg system problems, you got a lot of muscle there, and
right.
you want to get in deep with it, and that's
You
probably why it
you
works
might have
better.
to start with like lying on your laying in your lap.
Hmm.
You may want to put there, and you want to put on your calves.
Sure.
It's something you probably want to do before bed, and you can kind of hit all the areas of the leg and see if that
Right.
helps.
I would probably try the other ones first because they are kind of
Yeah,
expensive.
these are pricey.
Yeah.
They're an investment. So
Unless someone has one.
right. All right, number 4, establish good sleep patterns. So they're like, well, how can I sleep if it's going on? Well, one
Yeah.
thing is, I read a book on sleep. The number one thing that seemed to help establish good sleep patterns was going to the bed at the same time. Even if on the weekend, like let's say you normally go to bed at 10 during a work week,
Sure.
you should go to 10 on the
Right.
weekends too.
It's
Tough to do.
it's really just like raising kids. When your kids are young,
Yeah,
get them in that
get them
program,
in
get
the
them in the system.
habit.
It's
The
it's
body adapts,
yep,
to what
exactly.
you're gonna give it. Number 5, this was in the study in both clinics, so all 3 recommended this,
Okay, that's good.
was exercise. So you can do as simple as walking,
Yep.
but you can do biking both stationary or outdoors.
And now I think you mentioned this to me that typically people who get this are older,
Yes.
like over 50, over 60, or
Yeah, and plus a lot of people have neuropathy along with it. So
so that can be associated with diabetes.
it could
Diabetic.
be, sure,
Yeah.
yeah,
And if you have it, you probably know.
yeah.
Are we going to show
Yeah,
a couple
we'll
examples?
also show the Thick Glide. That's a device that we invented,
Right.
and it's for a person who can't. Uh, it's really to be used in the chair. It can also be used in the bed.
Right. But if you're unable to walk because you have knee
Right.
problems, hip or balance problems, and so you're, forced to be in a chair or walk short distances, this is a great way to get some exercise safely.
Yeah. So again, you could put this, and it's so lightweight. It's less than it's about
Right.
5 pounds, right,
Yeah,
Brad?
yeah, I got one finger holding it. Yes, sir.
So you can do it right at night, right before not right before you go to bed. You don't want to do heavy exercise right before you go to bed.
Right.
But maybe an hour before bed, you could get those legs moving, and you could kick up the stand there, and it's a little more comfortable. Now this is not silent. There's a little swish swish sound. You
Yep.
probably can't hear it because our mics aren't picking it up. But I just want to let you know there's a little bit of sound. And then also you can use it. Brett, you want to lay down?
Sure.
Lie down.
Lie down, Bob.
Lie down.
We keep those English majors off our back. We've
Yeah.
got to keep them happy.
Yeah.
That's all for our betterment.
Now you have to, if you do this, you either wear shoes or you put a towel down on top of it. But you can see how you can actually get those legs moving a little bit in bed itself.
Yep.
So and this is one of the few devices that'll do that. So
Yeah, works out very nice,
All
easy
right.
to clean. Bob, if someone is able to walk, you can walk. You can do stationary bike.
Yep.
Is that
Yep,
all
that's
good
all-
things
yep.
if you already have those, or you're thinking about that treadmill, etc.?
it all works. It all works. All right, number 6. This was both a study and at Mayo too. That you can actually use compressive devices or wraps.
Like ACE wraps.
Yeah,
or-
ACE
Mhm.
wrap, or you can actually. There's devices that'll fill up with air.
Sure.
And then,
Yeah. If you're going to do that, you need to probably get
Yeah,
trained or
check
instructed on
with
how
the
to do it so
doctor
you do it
first.
properly.
right, and that can affect your blood pressure and stuff like that.
Yeah,
so.
there's
Yeah.
that's you need help for that.
Number 7, massage. This
Mm.
was mentioned by I think possibly all 3. But this works well using the handheld massager for this.
Sure.
What I
Sure.
like about this is not a real aggressive massager.
Right.
This is not like the massage guns, which penetrate a lot deeper. This is to give you that light massage that would probably be appropriate for restless leg syndrome. And you
Yeah.
can, with the handle, you can get all the areas, and
Especially, if you're an older person. As a matter of fact, Mike, the guy who's doing the camera work for us, says, is it your grandmother, Mike, that she had the gun and it was too aggressive, and with one of these,
Yeah.
she was very
And
pleased with
the
it.
other thing, these are real inexpensive.
Yeah.
I mean, they're really a deal. So you can try one without spending too much cash. All right, number 9. No, sorry, number 8. Some light stretching. So you can do your hamstrings. Um, so you can even in bed, Brad. Yeah,
Yep.
you could just go like this, lift up your leg, and that's stretching your hamstring there
Yep.
a little bit. My wife does them this way, and she does them constantly because she was having trouble with her hamstring.
Keep you up at night, huh?
It really works well for her.
Good.
So,
Yeah, it's one of those things. Laying down, if you can do a stretch laying down, you're more relaxed.
and there you can go do hip adductors,
Sure.
and you can also do your calf muscles. You would need a towel to pull.
And sometimes simply doing
Yep,
ankle pumps.
Yeah, pull it toward you when you pull the toes.
Erp.
Yep. That all just gives enough stretch sometimes to relax it.
That's right.
Number 9, soaking in a warm tub.
Ooh,
That
now
actually,
we're talking about.
yeah, that can actually help your sleep too somewhat because
Sure.
that cools down your core once you get out of it.
Yeah.
So. And number 10, just as a rule of thumb, you're not supposed to try to resist the movement. Like if it's restless.
Oh, you mean the symptoms are
yeah,
making you like you don't want to.
You don't want to stop. Try to stop it by resisting
Oh,
it. It
that's
actually makes it
interesting.
worse.
Oh,
I didn't know that, but now I know that.
right.
We pass it on.
Well, these are some nice tips, Bob.
Give them a try. Experiment.
right.
That's what I want
Exactly.
you to do.
Exactly.
And remember, Brad and I can fix just about anything.
Except for.
A broken heart.
Oh, you're going to start singing
Oh,
lessons.
yeah.
I didn't know that. Yeah, you need some work yet, Bob,
Yeah,
but I'm
lots
sure
of
you'll get
work.
there. I'm sure.